In health news, the misuse of antibiotics continues to be a public health threat in low and middle-income countries. It is also one of the top 10 health threats in Ghana. Researchers at the Kintampo Health Research Centre in the Bono East Region who are working on anti-microbial resistance in communities within the region say the misuse of antibiotics is causing countless resistance to the treatment of fungal, bacterial and parasitic diseases in rural communities. They entreat pharmacists to sell antibiotics only to clients holding prescription forms.
There is antimicrobial resistance when antibiotics are no longer effective in the treatment of fungal and bacterial diseases that they are meant to treat. The abuse of antibiotics is a major factor that makes the body resistant to treatment, and once a disease is not treated, it can spread and affect others. Inappropriate use of antibiotics is increasingly affecting the health of a number of Ghanaians and leading to death in some cases. Study conducted in some selected communities in the Kintampo North and South districts of the Bono East Region by the Kintampo Health Research Centre (KHRC) in 2016 indicates that about 86% of the population was engaged in inappropriate use of antibiotics. A research fellow at the Kintampo Health Research Centre (KHRC), Mr. Samuel Afarisiudu, who is concerned about the high inappropriate use of antibiotics in rural communities, said such numbers are adding up to the antimicrobial resistance in the country. He therefore called on the Pharmacy Council and other stakeholders to consider training medicine sellers in the various communities to dispense medicine appropriately.
When you don't need antibiotics and you take it, and maybe you don't complete even the dose, the dosing regimen, the pathogens in your body becomes used to the medicines, and gradually they adopt to be able to deal with the medicines at the time you really need this medicine. The medicine is not able to treat your medication. So you may want to, if you have to be admitted in the hospital, you have to spend a long time in the hospital for them to be able to find the right antibiotics that will be able to treat your condition.
Mr. Samuel Afarisiudu said the study revealed that cultural complexities, lack of knowledge and easy access to antibiotics have resulted in their abuse and inappropriate use in the rural communities.
We have people pouring these medicines in their wounds. Some will even take it when they have menstrual cycles, difficulty in their menstrual cycles. Some will also even want to pour it in alcohol to treat hangover. And the fact that when you have a wound on your body, you pour antibiotics in, is able to heal you. That same assumption is also carried along, and people take it with alcohol in order to treat stomach sore.
Antibiotics, according to health experts, are not supposed to be sold over the counter without prescription. Antibiotics have over the years played a vital role in medicine, especially in surgery, but its misuse in recent times is a cause for concern. For GBC News, Mavis of Kintampo reporting.